Hi, my name is Sukhman Kaur. My student ID is 121381222 and I am here to make video on ambulation and dressing of the wound. Before entering in the room of my patient, I will ensure my hand hygiene. Hi, how are you feeling today? Good. I am Sukhman Kaur and I am your nurse today. I have checked the doctor's orders and I have the orders for ambulation and to change the dressing of your wound. It will take around 10 minutes because in this procedure I will remove the old dressing, I will assess the wound, and after cleaning it I will put the new dressing. If that's okay for you, I will now proceed with my procedure. Yes? Thank you for your consent. Can you please confirm your name? Okay. Your date of birth? Okay. And can I please see your ID band? And yes, it matches the records. Thank you. Now for assessment, I will ask you a few questions. Are you feeling comfortable? Yes. Okay. And on a scale of 0 to 10, how would you rate your pain, with 0 being no pain and 10 being the worst pain imaginable? 0. Okay, means you have no pain. Means you don't need any pain medication. Yeah. So are you allergic to anything, like any medicines, any food? No? Okay. So now I'm going to adjust the height of your bed. I'm going to reposition you. Can you please move closer to my side? And I will put the pillow on the other side. Thank you. Now I will provide privacy to my patient and ensure my hand hygiene. To open the tray. So to open the tray, I will open it away from myself while maintaining this 1-inch border here. And now I have this tongue, so I can readjust the tray. I will reposition my tray, manipulate the splice. I have these forceps here and gauze piece. I have enough gauze piece, so I will not add any extra gauze piece in this. And now I'm going to place this tongue here and to maintain the 1-inch border. Now I'm going to add Q-tip. Place it here. Now I will pour the NS, so I will also check the expiry date and I will put my hand on the information not to spoil it, and I will put NS from a reasonable height not to break the sterility. Now I'm going to make a triangle to put my garbage bin here. Now I'm going to put the garbage bag in the middle of my tray and patient. Now I will ensure my hand hygiene. So to remove the dressing of the wound, I will put on the gloves. Away from the tray not to break the sterility. And I will now remove the dressing. So as I can see the dressing, it is dry, there is no active bleeding and the fluid is serous sanguineous and there is no pus and no odor. So I can now throw it after assessing. So now I am going to assess the wound. As I can see, it is an abdominal wound which is closed with sutures, which I can count are 10 in number. And now I am going to check its length. And also there is no width and no depth of this wound because it is closed. So I will only check length. And I will match it with my scale, which I can see is 9 centimeters in length, and I will throw it. So also it is well approximated wound, and there is erythema, but I can't see any swelling here, and I will check it for pain and edema. Is it painful? No? Okay. So it's not painful for the patient also, and there is no edema. So now I'm going to remove my gloves. Ensure my hand hygiene and put on the new gloves. Now I'm going to start cleaning the wound. For this, I will pick up my forceps. Place it here. And now I will make a dumpling of this gauze. Wet it with NS. Squeeze it. And now I'm going to clean it from head to toe, and here is the head of my patient, and I am going farthest side first with rotatory motion and throw it. Take a new one. And now I'm going closest to me, head to toe. Taking third one. In the same manner but in the midline. Now I'm going to dry my wound as it's completely cleaned with taking a dry gauze. In the same manner, farthest from me. I will not care for this gauze, I will pick it afterwards. Closest to me. Taking third one to clean the midline. Now I'm going to put the sterile gauze to cover the wound. And after this I will put the abdominal pad, but I don't have it, so I am putting extra gauze. Now I will put it outside while maintaining the 1-inch border. And now I am going to tape it. And on this tape, I will write my date and time of today, and I will write my initials and put it on the wound, on the dressing of the wound, sorry. So now I am going to remove my gloves. Ensure hand hygiene because I have touched the garbage bag. Now I am going to adjust the height of the bed and reposition my client. You can now move to this side and I will remove the pillow. Are you feeling comfortable now? Yes? Okay. Are you feeling any pain now? No pain? Okay, means there is no need for medication. So here is the call bell and you can call me if you need anything. And also I will now report the findings which are regarding the dressing. As I can see, there it was serous sanguineous fluid, and there was no pus, no odor, and also there was no active bleeding. And regarding the wound assessment, I can see there was a 9 centimeter length, and there was an erythema but no swelling, no edema, no pain, and it was well approximated. I will document these findings and I will provide aftercare. Thank you.